The purpose of this webinar this afternoon is to provide an introduction to and training for your work with pregnant women in your programs as you screen them for risk of substance abuse during pregnancy. As we begin to think about screening pregnant women, the first thing I want to emphasize that this is not a process of simply checking off boxes and asking a woman a question, checking off the box, and moving on to the next one. Screening with the 4Ps Plus, providing a brief intervention, is a conversation. And we published an article a few years ago that's called Screening as a Tool for Engagement. And that's really what we want you to do, is to engage the woman in a conversation about her substance use. Now, as you begin to work with this population, there are some things you need to remember. And I'm going to summarize those right here just to emphasize their importance. If you're working with a woman who has a history of substance use during pregnancy, she brings to the relationship with you, to the relationship with her pregnancy, to relate her relationships with others, she brings with her a set of factors that make it difficult for her to address issues of substance use. These 5 factors are listed here. Let me explain them just very briefly. The first is what we call negative heritage, but essentially we're talking about family history. We're talking about early childhood experiences. And I'm sure all of you are familiar with the ACEs work that looked at the importance of early childhood experiences on long-term health and psychosocial welfare of adults. Many of the women that you're working with that are using substances come from families in which one of their parents were using. In fact, in some studies that we've conducted, we have found that about 30% of women who have a child with fetal alcohol syndrome, those women themselves have evidence of prenatal alcohol exposure. So you can see that this makes it all the more difficult to communicate with the woman and to really get at the risk factors that she's facing. The other issue in negative heritage is that the way we learn to parent is really from our own parents. And if a woman was raised in a home where there was violence, where there was substance use, where there was mental illness, she hasn't really gotten a good idea of how to parent. And so her relationship with her own parents is going to affect her relationship with her pregnancy and with the child once it's born. And these are all factors that you need to bring into your consideration as you work with the women. The second area is history of trauma. What we have found in our own research and also in national research is about 90% of women who have a history of substance use during pregnancy also have a history of significant trauma in early childhood. And one of the most pertinent factors that we find in the life of many of these women is a history of sexual trauma. In fact, some studies we did for the state of North Carolina and for Illinois, when we looked at women who were using substances during pregnancy and went back in their histories, what we found is that if you identify a woman whose first alcohol or drug use was before the age of about 11 years, then almost in all circumstances, that early use of drugs and alcohol was associated with sexual violence. In almost all of the cases, if the woman's first use was before the age of around 11 years, the perpetrator got the woman high or drunk and molested her. Think about what that kind of experience, what impact it has on the woman's approach to pregnancy now, and even in her relationship with you as you begin to discuss issues of substance use. A third area feeds right into that, in that most women who have histories of significant alcohol or drug use are living in isolation. They have very little social support. Now, what we know from human development is that one of the big differences between men and women is that women's lives revolve around relationships, and especially relationships with other women. Now, that's not true with men, but women, as a part of normal human development, need relationships with other women. But what you'll find in many cases, if a woman has a history of substance use, she is tied in to her male partner, who often promotes her isolation. So just because you're a woman working with another woman, it doesn't mean that she's going to automatically trust you, especially when you consider the history of early trauma and now growing up socially isolated and living as an adult woman socially isolated. So you have to work past that and have to understand that it's going to take some effort on your part to really develop the relationship that's needed. A fourth area is cognitive functioning. Now, most times when we talk about cognitive functioning, people automatically think of IQ. Well, that's not the only issue. In general, women who have been using alcohol or drugs for a long period of time have suffered some cognitive deterioration. But the primary effect cognitively is changes in their ability in the arena of executive functioning. Now, what is executive functioning? Executive functioning is the ability to plan and complete a task. Now, I'll give you a simple example. Let's say, just for example, that you're working in a home visiting program and you see a woman and you make an appointment. Okay, I'm coming back next week to your home. I'll be here at 4 o'clock next Thursday. And the woman may even write it down in her day planner, or these days put it into her calendar on her iPhone. And so you think, great, we're set. Next Thursday you show up, it's 4 o'clock. Where is she? 4:15, 4:30, 4:45. She comes strolling in. And you look at your watch, you say, what time is it? And the woman says, it's 4:45. And you say, but what time did I say that we would meet? And she looks at you and says, 4 o'clock. Now, the assumption people make at this point is that this woman doesn't care. She doesn't care about her pregnancy. She doesn't care about the health of her child. But in reality, the ability to plan ahead, to make sure she shows up on time for this appointment, that's very difficult for someone who has suffered long-term alcohol or drug use, because substances interfere with that level of cognitive functioning. And so instead of making an appointment with the woman for 4 o'clock, you have to add on, okay, if you're going to be here at 4 o'clock, what time do you need to start getting dressed? And if you're going to go, and she says 3:30, and you say, okay, now if you're going to go to the grocery store that day, what time do you need to leave for the grocery store so that you'll be back in time to get dressed for our appointment? And so essentially what you have to do is become her external brain. Now, many maternal child health workers, prenatal care providers, home visitors say, wait a minute, I don't have time to work with every woman on this kind of level of detail. But in reality, you'll save time and you'll have a much more successful relationship with the woman if you can begin to demonstrate to her how to plan ahead. The fifth area is psychological functioning. And what we know from our research is that, first of all, women who use substances are different from men who use substances, in that women who use substances have a higher rate of mental health co-occurring disorders. And the most common co-occurring mental health disorders we find in women who are actively using drugs and alcohol are depression and borderline personality. And of course, borderline personality means that she's very egocentric, that she is can only think of herself in the context of everything that's going on around her. And so that, of course, will interfere with her relationship with you and her relationship with her new baby. Now, you need to be aware of these 5 factors because, as we've talked, what I hope you've come to realize is that providing interventions, screening and intervening during pregnancy with women who are using substances. It's all about relationships. And you need to work on the relationship you develop with the woman, the relationship this woman has with her significant other, the relationship this woman has with her unborn child, and eventually with her child once it's born. And so you can see it's not just sitting down and asking some questions and using a checklist. It's really engaging the woman in a conversation until she gets to the point that she feels comfortable giving you the correct information. And this is how the 4Ps Plus was built. We started with these factors and asked, what approach can we take to ensure that we will help this woman move around denial? As we approach this, we developed a system that we call the SART system. And you will recognize this because out of this work, you hear about SBIRT. SBIRT is screening, brief intervention, referral, and treatment. When we first named this system about 20 years ago, 25 years ago, we called it SART. And so I'm going to stick with that terminology. SART stands for screening, assessment, referral, and treatment. Now, the purpose of screening is to identify women who are at risk for substance use. It's not to make a diagnosis. That's not your job. It's only to identify those women who are at risk. The second step is assessment. That is, any woman who has a positive screen who might be using alcohol or tobacco or illicit drugs, any woman who might be using, you're going to conduct what we call a field assessment. That is, right there in the clinical situation, you're going to assess the woman to find out who actually is using and who is at risk for using but not using. And following the assessment, incorporated into the assessment, is the brief intervention, and then, of course, referral, when appropriate, to an appropriate level of treatment. So that's the SART system, and that's the way, it's a very linear system, and that's the way that we organize our thinking around it. Now, of course, at the very heart of the SART system is screening. That's the first step. So let's talk a moment why we did develop this screening instrument. Most people, when they talk about screening, are talking about toxicologic studies. Now, there are two primary ways that pregnant women and their newborns are screened for substance use. By far, the most common is urine toxicologies. Urine toxicologies are very beneficial. They will identify any drug a woman took in about the previous 48 hours. However, they do not identify women who may have used a drug 72 hours previously. Alcohol, in fact, stays in the urine only about 6 to 8 hours. And so urine toxicologies are fairly inadequate for general screening purposes. They do have a purpose if there is a specific reason medically that a woman's urine has to be screened. But in the general maternal child health clinic, urine toxicologies really don't have a specific role. We published a study a few years ago. 1,500 pregnant women all underwent 4Ps Plus screening and all received a urine toxicology. The number of women that were found to have a positive urine toxicology was 2%. The number of women who were found through screening and assessment to actually be using alcohol or drugs during pregnancy was 20%. So you can see that simply talking to our patients, the interview, is by far the best way to approach this issue. Now, the other toxicology approach that is used once the baby is born is meconium toxicology. And meconium toxicologies have a great advantage in that meconium forms during the third trimester. So meconium screening will find any drug that the woman used in the last 3 months of pregnancy. However, the disadvantage is you have to be able to collect the meconium in a way that is correct so you don't mess up the toxicologic results. And often, meconium toxicology results don't come back for several days. So in a practical sense, it's not that helpful in the acute situation. And also recognize meconium testing cannot be done until the end of pregnancy. Now, when we first started our work, we looked around and evaluated a number of screening instruments that are available. The most popular and well-known is the CAGE. CAGE stands for, have you ever tried to cut down on your drinking? Have you ever gotten annoyed when someone said you drank too much? Have you ever felt guilty about your drinking? And have you ever needed an eye opener? That is, you were so hungover in the morning you needed a drink. The CAGE is an excellent instrument. It's well validated in white men. All of the early studies on the CAGE that validated the instrument showed that it works very well with white men to identify heavy alcohol users. However, years later, a group of researchers began doing a series of studies using the CAGE in women, not pregnant women, but women, and found that the CAGE lost its validity. So essentially they showed the CAGE, if you want to screen for heavy alcohol use, then the CAGE is a good instrument if it's a pregnant white male. Otherwise, the CAGE is not going to work for your population. As a result of those studies, several other instruments were developed. The NET, have you ever considered yourself a normal drinker? The eye opener question, and then T for tolerance. That is, how many drinks does it take before you feel a buzz, before you feel high? The NET will screen for heavy alcohol use. The TACE also is a well-validated instrument that screens for heavy alcohol use, as do the TWEAK and the Audit C. The problem with these instruments is they screen only for heavy alcohol use. Our philosophy, based in science, is no amount of alcohol is safe to use during pregnancy. So our goal is not only to screen for heavy alcohol use, we want to screen for any woman who is using any amount of alcohol at all, because a brief intervention with a light user is going to be highly successful in getting her to stop drinking. And we know from the studies, despite what's in the public media, if you look at the really good studies, we do not know how much alcohol is safe. And in fact, several studies document, both animal and human studies, that no amount of alcohol is safe to use during pregnancy. And so that is the philosophy behind the 4Ps Plus. The 4Ps Plus screens for heavy alcohol use as well as light alcohol use. In addition, it specifically screens for illicit drugs, which the other instruments do not. And like the TACE and the TWEAK, it was developed specifically for pregnant women, so it is gender specific. This brings us to Napa County, and we are going to start using the 4Ps Plus to start identifying those women who are at risk for using alcohol, tobacco, illicit drugs during pregnancy. So here's how it's going to work. I'm projecting up here the form that you will be using here in Napa County. At the top of the form, you put in the patient's name and then the appropriate site, the appropriate provider's office. You're going to fill in the other factors, including gestation age, and whether this is a pregnancy screen or you are doing this at postpartum, and then check off the appropriate race and ethnicity. And so a lot of that you can do before you ever come to the woman herself. This is where the screen starts. And as we did our research, and we worked with a lot of primary care clinicians in developing this form, and by far the biggest barrier that clinicians stressed in interviewing pregnant women is the fact that they had trouble getting into the questions. They felt very comfortable asking all sorts of other health-related questions, but when it came to something like substance use, they felt uncomfortable. And so here's our advice, and here's what has been very successful in getting people past this discomfort. And this is called normalizing the question. Now, we all ask family histories. Did either of your parents ever have a problem with high blood pressure? Did either of your parents ever have a problem with diabetes? Did either of your parents ever have a problem with drugs, marijuana, or alcohol? Now you can see how that flows. And when you start with the family history, what you're doing is just putting this into the medical or health context. And so you get away from that discomfort on your side, and the woman herself sees it as just another question about her family. And let's face it, most people do not have any problem talking about their family. But what you've done is you have introduced the topic of substance use. You can then go to the second P for partner. Does your partner have any problem with drugs or alcohol? And that's a simple answer, yes or no. And then the P for past. In the past, have you ever had any problems with beer, wine, or liquor? Now you'll notice here that we separated out alcohol because most people do not consider beer or wine to be a form of alcohol. So it's important at this point that we begin specifying beer, wine, and liquor. Now these first three questions are introductory questions. Their purpose is to help the woman feel comfortable with these questions. Not one of these first three questions has any individual validity. That is, not one of these three questions predicts the woman's use of alcohol or drugs during the pregnancy. But what they do is give you some insight, so as you think it may be needed, you can provide some substance abuse education. And when we get to the brief intervention later, you'll see that you may find that even though once we complete the form, the woman is negative, you may want to do a brief intervention anyway. Now, the other thing I would bring to your attention, under partner, does your partner have any problem with drugs or alcohol? As I said, that individual question does not have any validity as to predicting the woman's alcohol or drug use herself. What it does correlate, though, with is domestic violence. And from studies we did in California, actually, we found that if a woman's partner has a problem with drugs or alcohol, it's a 63% chance that she is suffering domestic violence. And so this raises a red flag. If the woman says her partner has any problems with drugs or alcohol, this raises a red flag for domestic violence. That brings us to the fourth P. Now these are the validated questions. The first three questions, you can change some of the terminology any way you want to. For instance, many people don't want to say partner, they say, does your spouse, does your husband, does your significant other have any problems with drugs or alcohol? So those first three questions you can change a bit. However, the three questions under pregnancy must be asked exactly as they're written. So let's look at those more specifically. The first is, in the month before you knew you were pregnant, how many cigarettes did you smoke? And then you can explain further. Now this includes e-cigarettes, vaping, and chewing tobacco. Now the important factor that I want you to look at here is if you change the wording to say, in the month before you knew you were pregnant, did you smoke cigarettes? The question loses its validity. That's called a closed-ended question. And what we know is that open-ended questions, how many cigarettes did you smoke, get more honest answers. The other important factor here goes back to the issue of normalizing the question. which is in the month before you knew you were pregnant. Now, if you change that question to say in the month before you were pregnant, it loses validity. You have to say in the month before you knew you were pregnant. So you've normalized the question. The woman can say, well, heck yeah, everybody drinks and smokes before they know they're pregnant, but I saw the light. I stopped as soon as I found out I was pregnant. That's fine. She can say anything she wants, but in the month before you knew you were pregnant, how many cigarettes did you smoke? If her answer is any at all, from 1 cigarette to 2 packs a day, that's a positive screen, and you check off any. Now, the second question is similar except for alcohol. In the month before you knew you were pregnant, how much beer, wine, liquor did you drink? Again, if she had any at all, including sips of her husband's martini once a night, that is a positive screen. And then finally, in the month before you knew you were pregnant, how much marijuana did you smoke? Again, we're not looking to diagnose addiction. We're not even looking to diagnose substance abuse. What we're trying to find in this phase is any woman who is at risk for using, because if you really think about this, first of all, this is high-risk behavior. And secondly, if the woman says in the month before she knew she was pregnant, she was smoking, that actually means she was smoking in early pregnancy. So those 4 categories of questions, the 4 Ps, are your basic screening instrument. Now, where does the plus come in? The plus is related to that arrow you see pointing down. If a woman had any tobacco use, any alcohol use, or any marijuana use in the month before she knew she was pregnant, you're now going to do the field assessment, which is the bottom half of the form. And last month, about how many days a week did you smoke a cigarette? Now see, what you've done here is you've moved from the screen in the month before you knew you were pregnant to now saying, and last month, essentially, which means since you've known you were pregnant, how many days a week did you smoke a cigarette? And last month, how many days a week did you drink beer, wine, or liquor? And last month, how many days a week did you usually use marijuana? And then you go to questions 4 and 5. And last month, how many days a week did you use any drug such as cocaine, heroin, or methamphetamine? And then finally, and during the month before you knew you were pregnant, how many days a week did you use any drugs such as cocaine, heroin, or meth? So what you can see is that these questions, this is called the field assessment, and these questions at the bottom of the form take it a step further. What is advised is that any woman who has a positive screen, that is, she used any alcohol, tobacco, or marijuana, must get these 5 follow-up questions. There are some clinicians, and I leave it to your clinical judgment, there are some clinicians who may have gone through the screen with the woman and feel a bit uneasy and want to ask the follow-up questions anyway. And that's perfectly fine. The 4Ps Plus is a clinical instrument, and you should use it how you best think you can serve your patients. Now, I want you to look at the form, and you can see the bottom questions. Some of the questions are in bold. What that indicates is if a woman answers any question with an answer that is in bold, meaning that she had any use of any of these substances in the second half, she needs a brief intervention. And as I said earlier, everybody who answers anything that is in bold on the bottom half of the form needs a brief intervention. Some of you will want to do a brief intervention just because you feel like you need to, and that's perfectly fine also. We would rather overdo brief interventions than than not do them when they're needed. What you do when you finish the bottom half, the field assessment, you're then going to mark the very bottom portion of the form. If a brief intervention is conducted, you check it off and you can see the checkbox. Also, any referrals you're going to make. Tobacco cessation handout, was the referral accepted? Yes, no, or if you didn't offer one, it's not applicable. Same thing for substance abuse treatment, public health nursing, and anything else. So what we're going to do as we look at your data, we're going to track and see how many of you are keeping up and following the protocol. So this is part of the quality control. If a woman has a positive screen and a positive assessment, but you didn't check off that you did a brief intervention, that's not good. And so we're going to be watching that, and then also watching to see what referrals are made, as well as what percent are accepted and what percent of referrals are rejected. And finally, over there to the right, you see what kind of insurance they had. You're going to mark that, the date, and then you're going to put your initials as the screener. So that's the use of the form. Now let's talk about a brief intervention. There are a variety of brief interventions available. Some of them are general, some of them are specifically for populations at risk. We have developed a brief intervention known as I Am Concerned, and I'll explain the title in a moment, which a lot of our groups use. And I know that you have purchased some of the brief intervention manuals, I Am Concerned. And so I'm going to talk about brief intervention from the perspective of using the I Am Concerned manual. Now, a brief intervention by definition takes only about 5 minutes. And its goal is through motivational interviewing to get the woman to come to consensus that she will stop using. And so what we're talking about here is a brief intervention strategy that has been developed specifically for pregnant women. So here's how it works. The first thing, after you finish the screen and the field assessment, is you give the woman positive feedback. Thank you for letting me know this. And then you say, I am concerned. Now, why do we say it that way? What we found in our research when we were developing this whole system, that the most common response, if a woman, for instance, said, yeah, she was having 2 beers a night during pregnancy, the most common response from the provider was, oh my God, do you know what you're doing to your baby? Or if she said, yeah, I use cocaine every once in a while, the response was, if you keep using, CPS is going to take your baby away from you. Now, either kind of response to the woman does nothing but drive her out of prenatal care. And that is what we do not want to happen. And so we want to give an I message. We want to take it on ourselves to say, thank you for letting me know. I am concerned. I am concerned because I know when a woman uses alcohol during pregnancy, her baby can be born too small and too early. And I know, and this is where you get to advising the client, I know the best thing you can do is not drink anything at all. It only takes a moment and it all flows, but this is a very important strategy right up front. How will the woman respond? Some women might get upset. Some women may just take the information as you're giving it, but you have to recognize that. And if the woman is getting upset, you have to say, I see you're upset. I know this is hard to talk about, but recognize her discomfort. Now, on the other hand, if the woman gets into denial, you say, thank you for letting me know. I am concerned because I know when a woman uses alcohol during pregnancy, her baby can be too small or born too early. And I know the best thing you can do is stop drinking. Many times the woman will come back to you with a statement of denial. saying, oh, I use with all my other pregnancies, a little bit of alcohol is okay. My other babies are fine. Now, she won't tell you they're all on Ritalin, but anyway, she'll say, my babies are fine. Some women will say, my mother used alcohol all during pregnancy, and look at me, I'm fine. You can't get into any kind of arguments. You don't want to get into power plays. And so that's why it's very handy to go back and say, I understand. And I can see that this is hard to talk about. But I know that I am concerned because alcohol, whatever drug she's using, can affect your pregnancy. And this is where you get into motivational interviewing. Now, I know you've had training in motivational interviewing, and so what I want to talk about is motivational interviewing in the context of using the I Am Concerned manual. So it's at this point, and I think you have some of the manuals there with you. And so since we've mentioned alcohol, let's turn to the alcohol page. And what you see is that the little handbooks have several tabs, and all different substances are listed on the tabs. This is important because if you try to talk to a woman who is using alcohol and you talk to her about drugs and alcohol, she'll take offense. She'll say, I'm not a drug user. I just have a little bit of alcohol every once in a while. Or if you talk to a drug addict, and this is a true story from our work in Fresno. I was working with some women who were using methamphetamines, and they were in prenatal care but refused treatment. And when I asked them, what's keeping you from going to treatment? They looked at me and said, that treatment program has alcoholics. Alcoholics are mean people. So what you have to understand, there is a hierarchy in the drug using community. And so that's why this I Am Concerned manual is designed to address specifically the substance the woman is using. So you turn to the I Am Concerned manual. She says, I can't believe you're asking me these questions. I only have occasional wine or a couple of drinks a week. And you say, I understand, but I am concerned. You turn to the alcohol tab. And what you see there is a script, and it's written in bullet point form. Now, you don't read that page to the woman, but rather you use it as a form of multi-sensory input. Now, what do I mean by that? Multi-sensory input from the education literature tells us we learn best when we can engage more senses. And so, for example, as I talk with you today, I'm giving you auditory information as well as visual information. We need to do the same thing for our clients. If we just talk to women without giving them any other kind of stimulation, it's going to go right over their heads. So that's why we use the manual. We open it up, and you'll see on that first page under alcohol, it's in English. And if you turn the page, you'll see the next page is in Spanish, so that the woman can listen to you and read as you talk about the various bullet-pointed information. And it's just like what we're doing right now. I'm not reading the PowerPoint slides to you, but I'm using them to reinforce the important points I'm making with you. Now, the other thing that we've learned from our research, you have to have pictures. And so if you turn the page, you see that there are a series of pictures of a child with fetal alcohol syndrome. And if you go to the back of the book in the large manual, there are scripts that tell you what to say about these pictures. But they're actually so easy and so obvious in these pictures that the client will be able to see these easily. And importantly, turn to the last page under alcohol and you see a brain scan. In the upper left-hand corner of that page, you see a normal MRI, and the larger picture in the middle is an MRI of a child with fetal alcohol syndrome. It's very easy to see those differences, and in fact, parts of the brain are missing in the child with fetal alcohol syndrome. So this is just a very basic approach using educational principles and to set us up to get into the motivational interviewing. Notice all the other, if you turn to any of the other tabs, you'll see this same series of information. You'll see the English bullet pointed information, the Spanish, and then a picture. For example, if you go under methamphetamine, you see the English, the Spanish, and then there's a picture of a baby who was born missing his hands and feet because of the mother's methamphetamine use. Now, we've had some people question this. Oh my gosh, if we show a woman this picture, it's going to scare her away from prenatal care. And actually, we found it's the opposite. First of all, remember that the only person that's going to see that picture, which is very tough to look at, but the only person who will see that is, in fact, a meth user. And they've seen a lot worse than that. So now you use that information, it's sitting there in front of you, and you move into the motivational interview. And a good way to remember this is OARS, O-A-R-S. First of all, you're going to use open-ended questions. So as you show the woman the picture, let's just stick to alcohol, show the woman the pictures of the child affected by alcohol use, you can say, well, tell me more about your use of alcohol. She'll begin telling you, and in most cases, she will say, I've been thinking about this. I have been drinking, but I just didn't know if it had any, ramifications for my baby or not. And so it's a good opportunity to then be able to affirm what she said. That's good that you've been thinking about this. So again, you're giving her positive reinforcement. As you continue talking, be sure to empathize. Whenever you see her getting upset, recognize that. Say, I see you are upset. I know this is hard to talk about, because in this way, you're going to enhance the motivation. Because where you want to get to is negotiating a plan. Now, a good way to do that, as she's talking about this, again, you're responding to her, you're saying, thank you for letting me know this. I know it's hard to talk about. I'm glad you've been thinking about this. So on a scale of 1 to 10, how ready are you to stop drinking? And she'll give you an answer. And let's pretend she said, well, I'm about a 4, which means she's not really that motivated at this point. But use that as a stepping off point to say, well, why did you give yourself a 4 instead of a 2 or 3? And that gives her a chance to say, well, I know it's important. And so I know that I want to. So you can, whatever number she gives you, you can go to a lower number. And essentially what you're doing is giving her positive feedback for at least giving herself a 4. And then this can move into personal choices. And this is where you get into some of the relationship issues. And you begin to talk, well, if you're a 4 now, how can we move to a 6? Give her a pathway for starting to cut back. Always remembering our goal is to get her to no alcohol use at all. And of course, that goes for any other substance you may be discussing. You're going to have to roll with resistance. Remember, keep saying, I understand, but I am concerned. Expressing empathy. Talk about the pros and cons. Well, that's really good, but cutting back to once a week is great. But remember, no amount of alcohol is really safe. And so we want to move forward. So what can we do to help you stop drinking? Again, I know most of you have been trained in motivational interviewing, but I think there were some important points I wanted to bring out here, especially as you begin working with the women and putting it to use with pregnant women. Because women are different from men, and pregnant women are different from non-pregnant women. And those are the kinds of issues, all the way from the psychosocial issues we first started talking about to how you approach motivational interviewing now. Obviously, you don't want to argue with the woman. You don't want to get into power struggles, which is why I like using I am concerned. You never want to lecture, and you never want to make assumptions. Okay, so one of the things that always comes up is people feel a little bit nervous, and they say, gee, you know, does this really work? And so that was one of the questions. We'd been working in Hawaii for several years when this question came up, and it was the state legislature that was asking us the question. And in Hawaii especially, there is a lot of concern about diversity and culturally appropriate practices, because the Hawaii form has 17 different races and ethnicities that can be checked off. We did a film, it's a very brief 3-minute film, interviewing providers and patients in Hawaii as to what their experience with the 4Ps Plus was.
Family is number one, ohana, taking care of the children. The children are the one that we have to take care of.
It's just important to have family. And the children is important too.
Many times, old school, myself included 19 years ago, was told that it is okay to have a drink or two during the week, on a weekly basis when I was pregnant. So has that really changed today? And do these women really know the implications of what can happen?
Really, it's surprising how many people do actually drink when they're pregnant, or smoke when they're pregnant, or don't think anything of drug use when they're pregnant.
In our community, yes, women are drinking while they're pregnant, or smoking tobacco, or using other types of substances.
What the 4Ps Plus allows us to do here as people and clinicians screening women who are positive for pregnancy allows us to discuss with them in a gentle and non-threatening way better choices around a healthy pregnancy.
Our program's been using the 4Ps Plus for I think about 2 years now, and we've really seen a positive response, one to just answering the questions. The women are really open and interested, and then using the brief intervention tool to making changes and learning from that, and we get a lot of questions and just a lot of interest in the subject. And the real discussion has started with the 4Ps Plus screening tool.
It gives me a script that I ask everybody. So it's not like I'm just asking this one individual because I suspect that she's drinking. I just say, well, this is just what we ask everybody.
It has good guides, which is great, so that whether it's yes or no, there's interventions and steps to take as far as what to educate them on next.
Using the 4Ps helps you to open the door in communication when you're trying to develop a trusting relationship with a new patient. It lends a safe period, a safe place where we can talk about any kind of alcohol exposure or substance abuse, and it's a first open door, and we look at that every time we see the patient.
When I was asked about drugs and alcohol, I can definitely say that I was comfortable and confident in talking about it. Having the Malama Perinatal Program to give me the information on what I shouldn't and should be doing, has made me a good mom. I'd like to hope I'm a good mom, and I think I am, but they pointed me in the right direction, and I think that having the Malama Perinatal Program can only help to prevent substance abuse in Hawaii, definitely.
Many of our groups have found making a film like that locally is something that helps bring the community together around this issue. So let's summarize now. You're going to do the 4Ps Plus screen every pregnant woman. If it's negative, that's a level 1 intervention. It's a handshake. It says, congratulations, great, you're not drinking, you're not doing drugs, you're going to have a healthy pregnancy. However, if the 4Ps Plus is positive, you're going to do the field assessment. So that means that in the month before she knew she was pregnant, she was using, but now that she knows she's pregnant, she stopped using. You're going to give her positive feedback, say, congratulations, that's great, and then you're going to give her some written material. Anything you can put in her hand that talks about alcohol or drugs, whatever the substance is, during pregnancy, that she can take home and read further. However, if the screen is positive and the field assessment is positive, then you're going to do the brief intervention, as well as consider moving her to other levels of intervention, such as group, outpatient, or residential care. Now that process varies from one community to another, but this is the general outline of what we just went through today. If you want more information, we have a lot of information on our website, and you can contact us through the website directly.